Welcome to the Holistic Growth Podcast, navigating business and natural health and functional medicine, where we bring you insights and strategies to help grow your practice and amplify your impact. Welcome, everybody, to the Holistic Business Podcast, the show where clinical excellence meets business strategy and purpose-driven practitioners learn how to thrive in the evolving world of integrative health. I'm your host, Dr. Tracy Stroup, and the podcast is powered by GetHealthy.store, your platform for building profitable, mission-aligned wellness business with the highest quality and practitioner-grade products. Today's special guest is not only a friend, but also an innovator in our industry, Jeremy Melecha, who is the CEO and founder of Biocanic. And this platform is actually radically shifting how functional health practitioners track, measure, and optimize client outcomes. So I'm so excited to have Jeremy here. He brings 25 years of healthcare experience, software innovation, and deep clinical insight. So Jeremy, thanks for being here today. I'm so glad to have you on.
Awesome. Thanks for having me, Tracy. I really appreciate it.
Yeah, well, we're excited because just to announce to everybody, GetHealthy and Biocanic have come into a partnership where we have done a full integration with your software. So that is something I want to put out there right at the beginning of this. So practitioners know that they have a solution that's available if they're using our software, GetHealthy stores, or if they're not. This is such an incredible marriage between our two systems. So I'm really excited to dive in and find out more about what you do. So can you give us a little bit about your personal journey and what inspired you to create Biocanic?
Yeah. So my background is biomedical engineering. So I've wanted to be in healthcare for a long time. I actually got into medical school, but then decided not to. So I went into engineering in a non-invasive cardiovascular device. So I was a signal processing AI machine learning back before it was easy to do, right? So I'd actually have to code those algorithms to kind of figure stuff out. So I'm a real data junkie. Always been active and into my own personal health and working out and sports and everything. Then I went to ResMed, led their connected devices initiative. So their CPAP device is the #1 connected medical device in the world. It's got a cellular chip on board, created a data problem for us. So we built software around that. And then that led us to acquiring into other electronic medical records, specifically in the out of hospital world. So things like skilled nursing, DME, home health. And so during that process, I got kind of a really good experience of technology and workflows. But then personally, I saw my own health declining. So I was, doing all the right things, organic, gluten-free, working out all the time, sober-tober or whatever. But my weight and my blood pressure, my back pain was increasing. And so I have a TED talk on it called Worst Day of My Life when the scale hit 240 pounds. So that really led me into the functional and integrative space. And so if anybody knows my wife, Jen Melecha, she's a practitioner. I was her first client. And we went through
Oh, there's a story there.
yeah. Yeah. So I went through the process as a client of a integrated practitioner, and it sucked. I mean, you have multiple lab tests. I had my supplement schedule in a Word document. Because I'm an engineer, I had a spreadsheet tracking all of my metrics, and everything was completely disjointed, right? And so I also saw her as a practitioner struggling, right? Because of all of that information, and all of our practitioners are focused on the individual, which means there is no script for each person. Each person's unique. And that means that they have to look at the intake forms. They have to order the labs. They have to download the labs. They have to review the labs. All of that is what we call death by 5-minute paper cuts, right? And if you think about, look, this person's coming back in 2 weeks. Who are they? What are we working on? What was wrong with them again? You go through that whole process over and over again. And that's really where we saw our practitioners really burning out from the stress and inefficiency. And so what they were doing is they were taking what is a traditional medical record, because that's what they were trained on, and trying to use it in functional and integrative medicine, right? And so when you think about a traditional medical record, it is built for episodic care, meaning I come in, I see you for 10 or 12 minutes, chart, refer, prescribe, and bill. That is not functional and integrative medicine. And so what we did is we built Biocanic around the clinical delivery model of functional and integrative. And so we take what you would expect out of a traditional medical record system. I say we turn it 90 degrees. We're built for long-term care and individual health programs at scale.
Wow. So you really come at this from both the client, tech, and biomedical sides, like all of that intertwined into this system.
Yeah.
So it kind of does make you a leader in both healthcare and software. So,
Hmm.
and I mean, obviously you've seen those two worlds colliding. So I had John on last week, and the reason he created Get Healthy was from a really poor experience. And here's what I tell people all the time. We just didn't know. We didn't know that what we were doing was so inefficient. But when you were talking about the client coming back and me sitting there going, who is this? What did I do with them last time? That is so true. See, I used to attribute it to my goldfish brain, but now I know it's just bad software. So that's really, it's really refreshing to hear. So you talk a lot about Biocanic being focused on health intelligence. So
Hmm.
can you define that for us? And why is that such a game changer with the integrative functional space?
Yeah, and it's health intelligence is the category of technology that we're building into, right? And so when you think about the traditional model where, hey, HbA1c is 6.5, therefore I do metformin and dietitian, and it's very allopathic and structured, right? Health intelligence is really about centralizing the data for the individual and providing that at the point of care both for the practitioner, but also for the client to understand where they're at. And so one of the stories that I always tell is I remember I was buying Thorne Dipan 9 and it's like $70 a bottle or something. And I went to my wife and I was like, why am I buying this thing again? And she's like, don't you remember on your BioHealth 401h on page 3, you had Candida and C. diff and we're doing digestive support? And I was like, I don't even know which report that was or why. Right. And so when you think about the end user experience, it's that old adage, what gets measured gets managed, is helping the practitioner explain the why of why I'm making these recommendations. Why am I doing a gut support protocol? Why am I doing an adrenal protocol? Why am I recommending a red light therapy? Why am I recommending a sauna? Right? How do those dots come together to give the person the intelligence to understand how to make the changes? And then also see the changes so that they get that reinforcement mechanism as they go through that program.
So you're kind of clarifying an educational aspect and keeping people from like data overwhelm. It
Hmm.
sounds like so, and that's interesting because I do think of the client patient outcome. Of course, I want them to be healthy, but the experience, for most practitioners, that's not what we're taught to look at. So
Hmm.
these seem like important data points to look at, and that it's being overlooked in the industry. So it's interesting that you've done that. So would you classify yourself as an EMR, the Biocanic software, or what would you say you are?
Yeah, so an electronic medical record is simply a software platform for healthcare, right? So yes, we do all of the things an EMR does, except we don't do insurance. We're 100% focused on the cash pay, concierge, out-of-pocket world. And we do scheduling, task management, we do the lab ordering, we do the supplement integration with GetHealthy store, we do educational components, so like things like learning management, so you don't need to have a separate system. We do diet meal planning, so you can put somebody on a dietary recommendation, and all of that information comes together. So we like call it an EMR, but on steroids, right? So we're doing all the things because the pain of being a practitioner and living in multiple platforms is where that burnout comes from. Having to bounce between different things. Oh, and now I need to go over here and make a supplement recommendation. Now I need to go back and then I need to go to the lab ordering portal and enter their information. I need to check if their results are in. All of those things add up. And so what we're doing is we're taking all of those systems and combining them into one. And so our strategy is if the workflow doesn't exist, we build it. If somebody's doing it great, we integrate, right? And that's really exactly what the Get Healthy integration means to us is there's no reason for us to build an e-com or a supplement or a dispensary and logistics because Get Healthy does that great. So we just need to make it easier so that we can just click of a button, make that recommendation, and it comes right back into the patient chart. They see their information and it's centralized for the practitioner.
That's awesome. What are some of the highlights of your technology and the software that you developed in this functional medicine space? Give me some highlights, like maybe
Yeah.
two or three that you're like, these are standouts for the
Yeah.
practitioner. And then I want to hear what are the highlights for your software for the patient experience?
Yeah. So for the practitioner, our big benefit is the ability to process and centralize all the lab data. So yes, there are some systems that may be able to track and trend, say, LabCorp or Quest data. We support over 250 of the specialty labs. So think Genova, Dutch, Diagnostic Solutions, ZRT, Doctors Data, Vibrant, what you name it, we are able to pull that data out. Why that's important is now you can look at an individual without having to open each individual report and get to the right page. So we create what's called the functional summary. So that includes client reported, scored self-assessments. So think about a medical symptom questionnaire, a GAD-7, PHQ-9. You can actually track it, auto scores it, so you can track and trend the self-reported data alongside of the lab data. And then you can see by system, gut health, hormone health, blood chemistry, tox burden, food sensitivity, genetic information in a single view. So that is a real delight that our practitioners love about our systems. And then more importantly, now you can actually track that information. So for example, my individual health journey, and this kind of gets into the client benefits, my the aha moment for me was I was estrogen dominant. So I would take a Dutch test and I would show up as a poor methylator for detoxing estrogens. So my 4-hydroxy, which for those don't know, which is the breast cancer marker that everybody looks at, was off the chart. Family history of breast cancer, mom, grandma, android fat storage and everything else. So I was not only filling the tank with estrogens, but I was also not detoxing them well. And that transition is what led me to lose 40 pounds, feel great, get rid of the back pain. So for me as a client, now I was like, hey, I'm here. I retest again, and you can see this dramatic trend and drop off. And it's reinforcing my supplement protocol and my dietary interventions alongside of the vanity of the weight and the body composition, improving over time. That is the engagement that keeps people on track. And then more importantly, for the client experience, because I'm seeing my data, it's connecting to my improvements.
Mm-hmm.
Now I become the marketing engine for my practitioner, right?
Mm-hmm.
People go, what happened to you? What did you do different? I'm like, well, I worked with Jen. I want to work with Jen. And so that's the delight component where that client experience now helps a clinician be a clinician without having to be on TikTok worrying about getting new leads because their successful outcomes and that experience is what drives the new people back into their clinic.
That was not what I was expecting you to say from the practitioner highlights and patient highlights, like, because I was thinking like, oh, just clinical outcomes, but
Okay.
you are solving another issue in the industry. I mean, let's just be honest. I'm a practitioner. It took me a long time to be a good business person and even a longer time to be a good marketer.
Yeah.
And it wasn't what I signed up for. I didn't go to school to learn how to do funnels and emails, and I went to school to help people get well. And then all of a sudden, I had to be an inventory manager, a front desk attendant, a marketer, a live stream video editor. And then on top of it, I had to figure out client patient outcomes and keeping everybody happy. So that's really a great answer. And I hope practitioners appreciate what you just said because it is a big thing. So you kind of, in your bio, you talk about being a post-pandemic solution, which I think personally, COVID changed everything. It's never going back. I mean, the in-person's fine, but people do like the online experience. And there was a major shift in patient expectations. So what role do you think your system has played in helping this era of patient empowerment? And what were some of the biggest roadblocks you ran into as you were kind of putting this out there?
Yeah. I mean, it's a comment that I actually talk about quite a bit. So when we started this in 2018, I was talking with, investors and people along the way. And I'm like, hey, we were going to build this platform for this industry. And people would be like, nobody's ever going to pay out of pocket. Right. And then the pandemic hit in 2020. And that conversation shifted to now all of a sudden people are hearing about the importance. What is my vitamin D level? The risk associated with comorbid patients relative to health outcomes relative to COVID. So now all of a sudden people became super aware. And then, like it or not, there is a general distrust of the health system coming out of that. And so through that process, I was like, well, people are motivated
This
now, but when the
episode is
pandemic
brought to you by
passes, are
Myos
people going to
MD.
stay engaged, or are we going to fall
What if
back
there
to
was a
our old
natural
ways?
way to
And
reduce
I
the
think
muscle
anybody in the
loss we
industry
all experience
recognizes
with age?
we're not going
Let me
back.
introduce you to
Come back.
Myos
And
MD.
thankfully, too. I
Myos
mean,
MD is a
we
powerfully
needed a
unique
kick in the
supplement
butt to the
designed
whole
to reduce
system.
muscle loss,
That's what
whether
brought
it's
it,
through
paid to the
aging,
men, you
injury,
know?
illness,
That's
or weight
good.
loss.
Yeah, and the
The
interesting
secret?
thing that has come up is,
Fortitropin,
I
an
jokingly call
all-natural
it the Joe
bioactive
Rogan effect,
compound developed by top
is
scientists
he's
and
talking
researched
about
at
you
some
need
of
to
the
get your
world's
hormones
finest
measured. What's your vitamin D
institutions.
level, right?
Here's how
So
it
it's
works.
now in the mainstream
Fortitropin
that
has
people
been
are like,
clinically
oh,
shown to
what
lower
is my vitamin D
myostatin,
level? What is
increase
my
muscle
free
protein
testosterone,
synthesis,
for
and
example?
reduce
And so
anabolic
now there's
resistance.
this
In
consumer
fact, in a
demand to getting that
double-blind,
information.
placebo-controlled study
And
at the
so the
University of
bar has
California, Berkeley,
changed
men
that
and women
the
aged
health
60 to
motivated consumer,
75
which is
saw
now
an
entered into
impressive
the mainstream,
18%
is looking for
increase in
that
muscle
objective
protein
data.
synthesis
I want
with
to understand the
fortitropin
why
compared to
for
a
the
placebo.
recommendation. I can't just say,
And
oh, well,
subjects saw these
you've
results
got gas, pain,
with
bloating after
no
eating. Here's some
additional
supplements for
exercise.
you. I want to
This
actually
isn't just
get
a
a
supplement,
test
it's
in
science
some
in
fashion
action,
that then becomes
helping
the
your patients
reinforcement
build
mechanism.
muscle,
And then
recover
the other thing
faster,
that we're
and
seeing
live
now is
powerfully.
with
To learn
somebody
more
who
about the
runs a
research and
large
benefits of
online
Myos MD,
funnel, like you're
visit
saying, does a
myosmd.com
total
today.
tox burden. People obviously come back lit up. To be lit up with toxins. Now all of a sudden they're like, okay, I'm going to do my 12 week or protocol. They want to retest because they want to know that that supplement protocol actually went in and cleaned out the glyphosate, got rid of the toxins. They want to see those improvements. And so now this whole industry and focus has really changed because now people are motivated, and they're motivated by that objective marker alongside of, feeling better, better mental clarity, weight loss, whatever it is.
Yeah, and I think people are highly educated now, right?
Mhm.
They're researchers, and not in a bad way. I always welcome the educated client because they're obviously the easiest people to work with. They know they have something going on. They want to effectively make change. They're willing to invest in it. And
Mhm.
then if you can provide them data on top of it, rather than just saying, trust me,
Yep.
and I honor people that do muscle testing and things like that as a way of measuring success. But for some people, and especially, I'm going to say, especially men, you guys
Mhm.
like data. You're data driven.
Mhm.
So when I can show you your blood work and say, hey, look how good your red blood cells are doing, and your cholesterol's in a nice, healthy range, and everything's back into normal, and your testosterone's optimal. Like guys are like, yeah, they're rock stars, and so are women.
Yep.
But I do appreciate. I think the testing part of your software is amazing. So when you have that whole field where it just pulls in, and it's a nice highlight. We can still go in and look at the whole test, but when you bring the highlight to the forefront, that saves a lot of time
Yep.
to be really focusing in on those factors then when you're looking at blood work or a GI map or whatever that looks like.
Yep.
And we're not the only thing you integrate with, right? So
Okay.
tell me some other tools that Biocanic integrates with that is changing the industry, and who are some of your biggest partnerships?
Yeah. So originally, our big focus was around wearables. So we integrate with all of the key wearables. So Aura, Whoop, Garmin, Withings. We even do functional medicine specific wearables. So things like heart math, temp drop. We just launched an integration with Mira, so an at-home urine-based cycle testing type of product.
That's an
Uh,
awesome system in case
yeah.
people don't know the Mira pod. I
Yeah.
have one. She sent me one. Just unbelievable what it can track and what you can see. So
Yeah.
sorry, I just wanted to give a little plug there. I think they're great.
Yeah. Yeah. And then so we do a lot of other integrations. So we do have an e-prescribe component as well. So as our, our clinics have gone into, say, longevity medicine or hormone optimization, we have that capability as well. But one of the transformative integrations that we've done is our CRM, or client relationship management. So you mentioned being a business operator and doing funnels and everything else. We now can provide that service so you can have a full tech stack that operationalizes your business. So, for example, one of our common customers sets up a website funnel. Hey, get a food sensitivity test, work with me. They fill out the form, they process the payment, and everything is automated. So the person's onboarded, their intake forms, their legal agreements are all auto assigned. They order the labs, the lab results come in. When the lab results come in, it triggers an email, book your follow up appointment. That follow up appointment is with the sales team to get them into the one on one program. And in that whole flow, that practitioner does not lift a finger, right? There is no data entry, there is no follow-up, there is no review. It's all automated. And that's one of the really exciting things that we're seeing is once, it does feel a little bit daunting for a practitioner to say, I don't really have the tech, but we provide turnkey solutions. We have community support. We help, show examples of how you can set up a funnel, how you can connect it to your website. And that has really been a game changer. And it really, we have one customer that uses the platform that can launch and do 1,000 microbiome tests in a day in terms of their reach and onboarding.
Holy man. So
Yeah,
the onboarding process, all automated, I mean, that's big,
yeah,
because that's usually where you lose the client.
mhm,
They'll come see you once, but if there's not a good follow-up and keeping in front of them, people have lives.
yeah.
You're not going to remember to make their next appointment. You have to continually reach out. So I love that aspect of it, that it will follow up and do the things that, yet again, we
Yeah.
practitioners are not good at. So very, very,
How many times has a client showed up to a visit without filling out their intake form?
oh yes, all the time,
Now
right?
you can automate and say, hey, you haven't filled out your form and your appointment's coming in 3 days. If you don't fill this out, we are canceling your appointment.
Mm.
Right. And so now that, again, that inefficiency of having an ineffective intake call because they didn't provide the upfront information now gets streamlined. Right. And so
Get
you're,
the testing.
yeah,
Yeah. Well,
exactly.
I love it. Your technology puts boundaries in where we as practitioners have very unhealthy boundaries.
Yeah, exactly.
It's like it's such a thing. So I'm going to ask you a little bit about the Get Healthy integration and how that's
Mhm.
been working for you as
Yeah.
a company. Also, any feedback from practitioners? Has it helped the Biocanic system? What have you found with integrating with the solution set? And just so people are aware, there's an embeddable app that pops
Yeah.
up inside the Biocanic software. So you never even leave your software. You don't have to go log into your Get Healthy store. If you have a store, it can be API integrated. That will pop up and you can write and dispense your supplements, your non-supplement products, everything right inside the Biocanic software. So what is some of the feedback that's happening?
Yeah, it's been great feedback. So for people who do not have a store, you by default you can use Biocanic has a store that you can play around with. So if you want to see the Get Healthy experience, see the product catalog, that is available to anyone that is using Biocanic today. If you do have your own store, then what we do is we just connect that integrated app to your personal storefront. So we have, a few different customers that have really high volume stores. So we just update it on the back end. And then you seamlessly go to the patient chart. You're going to say, hey, I'm going to create a new protocol. It opens up into Get Healthy store. You create your protocol, your kits, your med packs, whatever you need to do. Throw in some Therasage, a hydrogen water bottle, a red light pad, make that recommendation, and then we pull that back into the client chart automatically. So this is a really key experience because it's a e-commerce experience that can match your brand. And so we also white label. So for example, if it was, I'm, mypractice.com, you can have portal.mypractice.com, mystore.mypractice.com, and then that business has that seamless experience. There is no other brands, what's this, where do I go this to order? It's everything in one spot for you, which not only simplifies your operations, it also improves that client experience, right? Because they're only existing in your ecosystem, even though all the systems are a bit different.
Yeah, so behind the scenes, it's a lot of talking and chatter, but to the client, it's one click. So
Yeah.
it's perfect. I want to go back to what you said about having a Biocanic store. If somebody has a Biocanic account but doesn't want to take the next step to have their own store, I think that's a great service you're offering.
Yep.
Can you just expand on that a little bit? Because I think sometimes practitioners worry about like, well, it's not my brand.
Mhm.
How do you kind of offset that fear and how do you transition those people out of the Biocanic store into their own kind of atmosphere?
Yeah, so it's under the Biocanic brand. So the client is already experiencing Biocanic because that is their portal where they're logging into. So it actually eliminates a potential other branded exposure. But it also creates kind of that end-to-end experience. So it's a great starting point. So similar, if a practitioner wants to use our store, we offer discounts and commissions, just like any other store would as well. So just let us know about that. But then they can try it out and get an understanding, make sure that it works. And then once they're ready, I mean, obviously some new practitioners aren't ready to go jump right into the supplement component yet. They just want to get their legs under them around working with clients. Once you get to that next level and you're like, hey, I'm ready to brand my Biocanic, I'm ready to get my branded GetHealthy store. All you do is you just fill out a form and we just move that embedded app to your individual store, update the branding, and now you have that seamless end-to-end experience. It takes less than a day for us to do that.
No, I think that's a great way for practitioners to start. We hear that a lot, like, oh, I'm not quite ready for that. This is perfect. So they could go in, have a Biocanic account, be able to script supplements through your dispensary that pops up in the Biocanic. It's still their patient load, still their end-to-end experience. Their patients are getting satisfied, they're making money, and they don't have to take on the burden of more tech fees or, any of that. So I think that's incredible. So a few kind of personal questions, not personal, but business personal. So personally or professionally in this movement towards smarter health, what's really exciting you of what you're seeing, what's coming, and how is Biocanic going to get in front of that innovation? Do you want to share that? I don't want to give away any trade secrets that you're working on, but
no, I mean, obviously everybody's in the hype cycle around AI and health. AI is a great workflow tool. It's a great way to create efficiency. So content development, charting, scribing in the background, saving the time from typing everything up. It's great. We do have an integration with an AI scribe called Heidi Health, medically focused. It's great. It's a great workflow and efficiency tool. One of the things that gets hyperbolic is around this idea of personalized recommendations that, oh, AI is going to solve what a clinician can do. People that claim that are lying or naive. The data just doesn't exist, right? How would an AI know how to interpret a vibrant total tox burden, for example? There is no training data for that AI to have learned anything, and an AI is only as good as the data that it's seen. So where we're really excited is we're at the starting gun essentially for a marathon when it comes to this. And so we're working in a number of different clinical trials. One really exciting one that's been being presented now is a pediatric autism study. So this group and partnership with Purdue University did 8 tests at week 0. So blood chemistry, food sensitivity, microbiome, genetic testing, organic acids, heavy metals, environmental toxins, and mycotoxins. And then at week 12 retested. And their only intervention was to switch that person to an organic whole foods diet. All of the autism participants had some sort of wheat or dairy reactivity. So removing those products. Every single individual improved their behavioral-based scores with that simple intervention, right? And so now we have this really interesting component, which is every single participant was off the chart for a toxin called ochratoxin A. It's actually a food-borne mycotoxin. It contributes to kind of neuroinflammation. Now, just removing and getting onto an organic food side, that dropped, the neuroinflammation dropped, their behavior-based scores improved. There's also the whole bunch of data. So in the something like 250 different SNPs that we looked at, there was 100% overlap and some key SNPs related to detoxification in this kind of pediatric cohort. Really interesting information. The question is, does that contribute an inability to detox those particular environmental or food or mycotoxins? Is that a component of what's causing the neuroinflammation or the behavior outbursts? So really exciting stuff. And guess what? There's no AI that can synthesize this data. It's literally, 4 PhDs, myself, other industry, under the other lab testing partners, and we're pulling together hypotheses. We're representing follow-on studies, particular interventions, particular approaches. So that's really what's exciting, because never before has that information ever been collected on a pediatric group. Only now, because of the availability, the focus, the understanding, can we actually move this forward, right? Everything that's been done prior is all about pharmaceutical interventions.
Right.
Now we're actually talking about an integrative approach, simply a dietary intervention, but are there other things that could possibly help out?
Yeah, I think that's a big stigma with AI, right? Is practitioners think somehow the thing's going to take over. And it always needs our brain. It's more of an efficiency tool if we look at it. And yes, it can grab data very quickly and bring it into one area, which is great. It saves us a lot of time. And that is the number one complaint of practitioners is they don't have time to market. They don't have time to do the business stuff. They don't have time. So if we can give them some time back, I think it's a great tool to have to take some notes and get it interpreted to client facing summary. That's usually how I'll use my AI tool. I'm like, give me a client facing summary on my notes.
Right.
And it will just write it up in a professional manner. And I will say, put it in layman's terms so my client understands what I'm saying. And it will. So I think there's some great efficiency tools using AI. And I don't think it's something to be scared of. I think it's something to embrace. So I appreciate that you actually are
Yeah.
utilizing it and making it part of your software.
Yep.
All right. So two last things. So for a new practitioner, would Biocanic be a fit and why? And then for a practitioner that's been in the industry and wants to scale, basically, I want you to kind of sell me on these two
Yeah.
genres, new or, been in the industry forever. How does Biocanic make their practices more efficient, their patient outcomes, better? Tell me what you think.
Yeah, so for a brand new practitioner, there is no better option. We're the most cost-effective one out there compared to all the other platforms out there. And if you're getting started, we have everything turnkey for you. So we have pre-built assessments, pre-built programs, example supplement protocols. We help you with the onboarding. We have a lot of support. So getting going with us, if you signed up today, you could be working with clients in an hour. That's how simple it is. Now, for the established practitioner, it can be a little bit more time consuming. What system are they coming from? How much data are they bringing across? What's their assessments look like? So my whole team has an onboarding process, right? So, hey, you have a specific intake form that is a combination of a cell core assessment and an IFM intake form. Our team member helps build that out for you, make sure that it gets into your system. We'll train you, we'll get your calendar connected, get your scheduling links. That data process does take a little bit more time. And then also, if it's a busy clinic that's struggling to scale and they need the efficiency, where you got to find the time to get trained and onboarded so that it's like, okay, we're going to meet every week on Friday afternoon for an hour. We're going to get the team trained up. We're going to focus on getting the admin up, and then we're going to bring the clinician in last. So we work in a lot of different ways. We do a lot of data imports. One of our most successful partnerships, if anybody's using Serbo or MDHQ, that's a great option because our practitioners will keep Serbo, so they're familiar with their charting approach, but then we connect on the back end. So we provide the efficiency, the decision support, the data analysis, the ability to connect to the GetHealthy store, and they don't necessarily have to upset the operations. So it gives kind of a 1+1 = 3 partnership. So
Mhm.
that's a great example. So we love our partnership with Serbo, and we've been getting a lot of new customers on board, and they're all in the same boat. Busy, overworked,
Yeah.
constantly opening up windows and tabs, and they have multiple monitors. And even despite the inefficiency, they've grown, they're successful, they have a wait list, but they just get stuck. And then we come in and we give them that extra 20 to 30, 50% efficiency that allows them free time to actually, enjoy your family at night rather than charting and documenting, or
Yes.
or B, scale up and cut that wait list down and get more people in and grow their revenue for the clinic.
Well, that's awesome. That's an interesting partnership between
Yeah.
Serbo. So very cool.
Yeah.
So as we finish up here, why don't you leave us with a comment or a word? And also, can you tell us how to get involved with Biocanic? Is there a free trial? Is there anything that we need to know when we're coming to the website, and how do they connect with you?
Yeah. I mean, this is an amazing time to be in our industry, right?
Mhm.
Even 6 months ago, before the administration changed and the focus on, working to improve different approaches that are not pharmaceutical based, is a great tailwind, but the industry was already moving in this direction at a really great rate. So really excited, and I think that's just the general word is excitement. To getting started with us, so we are Biocanic, biocanic.com. That came from the word biology mechanic. So the idea that you kind of plug your car in at the mechanic, it tells you what's wrong. Yes, and we have a 14-day free trial. If somebody needs an extended trial, hey, life happens. We're totally fine with that. We do a ton of demos. We want to learn about your particular clinic, your operations, and then highlight how we can help out. And so my team is all ex-practitioners or practitioners with a side hustle going. So we help our practitioners really streamline and scale up. And that's really fun because, our customer success drives our business success and also drives better patient outcomes. So it's a great business to be in where the incentives are aligned, right? So everybody wins across the board.
Yeah, awesome. Well, I certainly appreciate everything you've done for the industry. Thank you. This has been an incredible conversation, and you're truly a pioneer in the world of data-driven functional medicine. So it's what we need. I know it's what practitioners don't realize it's what they need, but it's what they need. So, guys, if you're a practitioner and you've been craving a more streamlined, intelligent way to track your patient progress, or build protocols, or just simply manage the complexity of root cause care, I really think Biocanic is something that you need to look at and consider. You can learn more at www.biocanic.com. I will make sure that link is in the show notes. Make sure you follow Jeremy and Biocanic on all social media channels and give GetHealthy a follow as well. And if this episode sparks something in you, be sure to subscribe, leave us a comment, and make sure you share this with somebody else in the health industry that could really use this tool. So until next time, we really appreciate you being here. Stay rooted. Remember, your body was designed to heal. You just need the right tools, truth, and team behind you. So thanks for listening. And thanks, Jeremy, for being here. It's been awesome.
Awesome. Thanks, Tracy.
Mhm.